Okay, so I'm gonna do the newborn assessment. I've got the baby. I put it on the bed warmer, make sure the baby's dry, and I took in all the wet towels already, the blankets, and I'm gonna start with the vital signs. So I'm gonna listen to the apical pulse for 1 full minute. Okay, and then while I'm listening to apical pulse, I'm gonna go ahead and listen to the whole heart and the 5 points. Okay, I'm gonna listen to lungs and respiration. And I'm gonna listen to the bowel movements. Alright, all bowel movements are active in all 4 quadrants. Respiration and heart rate. Apical pulse were within range. Lungs were clear, and no evident signs of distress or pain are coming from the baby. And now I'm gonna go ahead and measure its height. So I'm gonna go bring the baby up to the head of the bed. I'm gonna mark it with my pin, and then I'm just gonna move the baby a little bit, and then get my tape measure, measure it in centimeters and in inches for the parents. And now I'm gonna measure. Now I'm gonna weigh the baby. So I'm gonna take the baby, put it on a scale, weigh it in pounds and ounces for the parents, and then in grams for us. And then I'm going to get my tape measurer and measure the head right above the eyebrows, right here, and in centimeters and in inches. And then while I have the tape measure, I'm gonna do the abdominal right above the umbilicus, and inches and centimeters. And then I'm gonna do the chest while I have a tape measure. Okay, right there along the nipple line. And then I'm gonna actually measure the budding of the nipple in millimeters. All right, so I got that. It's all within range. And skin color of the baby is mostly pink on the torso, a little cyanosis on the fingers and toes, which is normal right now. He was just born. And then also very soft skin texture, trigger, trigger, or in check, nice, hydrated, bounces back within 3 seconds. I don't see any rash or any sorts. A little bit linguinal on the shoulders, which is normal for a baby. A little bit of vernix on the upper arms, which is normal and will go away in a few days. Alright, so reflexes, we're gonna take the reflex and get the pin light. So, there's a blink, and then let's see if the pupils react. Pupils react and they're round and equal. And let's see, they do follow movement. The eyes follow movement and coordinate nicely, even and smooth. No problems with the eye. So we're gonna do the moral startle. So he's gonna pick him up a little bit and drop him, and then he startled a little bit. It's fine. Now we're gonna do the rooting. I'm gonna put my finger along his cheek, and his head turns, trying to suck my finger. Yes, normal. And now I'm gonna check for his sucking reflex. Put my gloves on, and then I'm gonna put my finger in his mouth, and he instinctively sucks my finger. I'm feeling on his hard and soft palate, both intact. And then I'm gonna turn a pin light. Look at his tongue. Is has some attachment, but not completely attached to the bottom of the mouth. Doesn't seem to be abnormal. And then let's see. Okay, so next will be the palmar and plantar grasp. So I'll put my finger in his palm. He instinctively grasps my finger, and then the same for his foot, and instinctively tries to wrap his foot around my finger. And then the Bobrovsky, so I'll put a little upside down J, and his finger, his foot reflex on that. And now the stepping, so I'll grab the baby, and he instinctively tries to step. It's normal. Alright, and then the tonic neck, so we'll turn him this way, and his arms and legs should turn that way, like that, which is normal. The other way, same thing, his arms, his foot go out. There you go. Alright, and then the prone crawl, we'll flip him to his stomach, and we'll see if he tries to move or inch a little bit. And yep, that's normal. And trunk curvation will touch his side right here, and he should turn towards the stimulus reaction. So it goes like this. Yep, he turned towards my hand where I rubbed them. And then, okay, so we're gonna go on and observe his head. So his head is round, symmetrical. There doesn't seem to be any molding, so which is good. Frontal and occipital frontalis or papal, and smooth and move freely. And then the face, there seems to be no marks on the face. It was a vaginal delivery. No forceps or vacuum were used. There's a little bit of melia on him, which is normal, which will go away in a few days. His ears, we're gonna check his ears. So ears, I kind of move the cartilage front a little bit, and it recoils quickly back. There are no signs of lesions or scars, and both ears will be symmetrical to each other and on the side of their head. And the ear canal is patent, and so are the other one, so that's fine. Now we're gonna check his eyes. His eye placement is symmetrical within the face and symmetrical to each other. The outside orifice of the eye lines up with the top of the ear on both sides. And then eyelids, they're a little swollen, which is normal because we put that ointment on and he's just a newborn. Lashes are present, eyebrows are present, both symmetrical and full. The cornea and sclera are clear, and a little blue tint on the eye. And then we say there's a little swelling on it. And then the nose is flat and symmetrical to the face and midline also. And we're gonna make sure his nostrils are patent with each other. So I'll cover one nostril, no problems breathing. The other nostril, no problem breathing. Alright, and then we're gonna look at his neck. His neck is short and no signs of extra skin folds whatsoever. And it's straight. It seems to have full range of motion, no stiffness or problems with head motion. We're gonna check his clavicle, make sure there's no break. So clavicles are very straight, no abnormalities are felt, and like his arms are able to move freely, no resistance whatsoever. So we're gonna go on his chest area. His chest is wider than it is narrow. It expands when he breathes very easily. There's no depression on it. And we'll go down to his stomach. So appearance of the stomach is round, soft, and the umbilicus is midline. No swelling or hernias on the umbilicus, and the cord seems to be fine. No redness on it. Okay, and then we're gonna palpate for the femoral pulses. So I'm just gonna go ahead and put my hand here. All right, that's nice. Nice and even. We're just make sure they're both even with the brachial. Alright. Very good. Okay. Those pulses are palpable and rhythmic and even with each other. So extremities, so we have full range of motions on his hands. His arms are short, his fingers are short but not that short in both hands. 5 fingers and 5 toes. And then his palms have 3 lines and not one single line crossing on it. So his legs are also short but longer than his arms. His feet are small. All 5 toes are present. And we're going to check his hip joints. So I'm just going to do this and rotate out. Alright. There's no clicking or no resistance on either hip joint. And I'm going to go ahead and look at his spine real quick. And his spine, midline, no patches of extra hair, and a little bit going like a C, which is normal. And let's see. No signs of jaundice, which is good. And he's had his bowel movement a few minutes ago, which is first bowel movement, which is normal. And he hasn't urinated for us yet, but we're pretty sure he will. So we're going to check his, well, it's going to be a boy and then a girl. So first we're going to check his penis. So penis is midline. His testes, we're going to test his testes. Yeah, they're both descended. They feel well intact. And then if it was a female, we'd check her vagina, and the labia major would be covering the clitoris, and it is. You can't see the clitoris, so it's normal gestational age. And then we're gonna make sure the anus is patent, and it is. Okay. Where's my light? Let's make sure. Yep. All right. So there's no signs of skin tags or lesions within the genital areas, and the baby has been crying, so that means he has good vocal cords and able to breathe and do all that. And that's it. And we'll wrap the baby back up and give it back to the mom.